Today we're going to talk a little bit about HIV. We will discuss prevention, reduction of harm, and treatment. To begin, it is important to know who is a target for HIV. The answer is simple. Anyone can be a victim of HIV. However, science and statistics have shown us that certain groups may be at greater risk than others. Let's look at some data. In the US, there are more than 1.4 million people living with HIV. Of those people living with HIV, 76% of them are male and the other 24% are female. So men tend to be more susceptible to contracting HIV. Let's look closer. Out of the 1.4 million people, 28% are white, 24% are Latin or Hispanic, 44% are black, and only 17% reported to be heterosexual, and 83% reported to be homosexual or a participant of homosexual activity. These numbers tell us that different groups may be at different risk. So what can we do to prevent HIV? The primary method is a change in behavior amongst the uninfected. The secondary method is to change the behavior of the infected. The key is awareness and education. A primary method example would be promoting condom use or improving communication between partners. This can help to prevent the contraction of HIV. A secondary method example would be to prevent individuals from needle exchange or free condom distribution. This can help to prevent the spreading of HIV. So what can we do to get the message out? Marketers use what they call the 4 P's. The first P is product. The product is often the solution to a consumer problem. In this case, health behavior is the product. The second P is price, or what's it going to take for the consumer to get the product. Money can't buy health behavior, but what can is time, effort, or even self-esteem. But the price is worth the product. The third P is place, or how the product reaches the consumer. This means we must use methods of information disbursement such as doctors' offices or mobile clinics. And the fourth P is promotion. To create an awareness of this product, it needs to be promoted. This can be achieved by using elements of effective communication such as seminars or spokespersons. This is just a start. There are many other ways to achieve these goals. But what if you're too late for prevention? For some, prevention is no longer an option. However, treatment is. Many think that once they've contracted HIV, their life is over. That is far from true. Many people live a long, normal life with the proper care and treatment. There are various treatments available to people with HIV. The main treatment is called antiretroviral therapy, or ART. This can effectively suppress the virus, restore immune function, and can improve the quality of life. This, however, can involve taking expensive regimens to prevent severe life-threatening side effects. There are many ART drugs that vary in cost, effectiveness, and side effects. In the US, HIV treatment is accessible to most people. However, more than 30% of the people in the US who are infected with HIV choose not to pursue treatment. Reasons for this often include mistrust in healthcare providers, drug use or history of drug use, fear of discrimination, fear of stigma, or denial. There are also several programs to help individuals receive treatment, especially for people with lower incomes. These programs include Medicaid, the Ryan White HIV/AIDS program, Children's Health Insurance Program, Veterans programs, and more. The best thing for someone to do is to consult a physician. They can help recommend suitable treatment and also provide information on HIV assistance programs. Or you can go online to find programs or locations that provide information nearest to you.
Created using Powtoon.